Hello, my name is Danielle. This is my week 12 video. I completed 85 questions on Kaplan and then the self-assessment on UWorld this week. I went over my missed question rationales and my three that I missed most. Number one would be the nurse provides care for a client diagnosed with a cerebrovascular accident. Which action by the nurse is most important? Number one, ask the client to discuss the perception of health status. Number two, identify the client's strengths and weaknesses. Number three, encourage the client to discuss concerns with the client who has rehabilitated from CVA. Or number four, offer the client an anticipated schedule and written plan for therapy. Since this person did have a brain injury, I chose number two, identify the client's strengths and weaknesses. That way you can make a plan based off of that, a teaching plan based off of that, and to help them improve. And that answer was incorrect. Although it is appropriate, it's more important to determine the client's perception of health first. So number one was actually the answer, and number one states, ask the client to discuss their perception of health status. For teaching to be successful, the nurse should assess the client's perception about the health status first. So I guess knowing where they stand, where they believe they stand, can help indicate their strengths and weaknesses, which will help arrange a teaching plan for them. So that makes sense why that would be the correct answer. My second question was a case study. So for history and physical, it says the client reports 2 weeks of increasing fatigue, shortness of breath, back pain, and generalized malaise. Client reports struggling with obesity since high school, history of poorly controlled hypertension for over 30 years, hyperlipidemia for 15 years. Client smokes a pack of cigarettes per day for 20 years and quit 10 years ago. Stopped drinking alcohol 5 years ago and has a secondary job and rarely exercises. Review of systems, admits to gaining 10 pounds over the last month and explains the previous recommended no salt, low fat diet was too hard to follow and didn't taste good. He noticed increasing shortness of breath, especially when lying down. No coughing or fever, denies cardiac issues other than blood pressure, admits not taking blood pressure medications and diuretics for the last few months. He also states that he noticed his urine dark, tea-colored, and sometimes foamy, denies any pain, urgency, or foul odor, describes back pain as dull ache and mild in mid-region, and does not recall having any injuries or heavy lifting prior to pain onset. Feet and ankles swell significantly during the day, but no other issues after that. His blood pressure currently is 164/92, heart rate 67, respiration 18, temp is 98.6, and SpO2 is 93. Which goal is most important for the client to attain at this time? I put improve SpO2, and because his SpO2 was at 93, and the correct answer was decrease fluid overload. So I just thought of my ABCs. That was incorrect though. The fastest way, it states that the client's most concerning symptoms are fatigue, weight gain, and shortness of breath, swollen feet, ankles, elevated BP, and SpO2 caused by fluid overload. So the fastest way to improve everything is to get to the main problem, which is the fluid overload. Once that's getting resolved, everything else follows. So that makes sense why it would be incorrect, and the correct answer would be fluid overload. The last question is also a case, it's not a case study, it's putting things in order. So a client who is experiencing palpitations but otherwise appears stable is admitted to a telemetry unit. He's on a 5-lead monitor. The nurse notices the client's rhythm appears to be supraventricular tachycardia. How will the nurse respond to this information? So we have to put in a correct order. My order was verify lead placement and rhythm, measure the client's blood pressure, obtain vials of adenosine, and then notify the healthcare provider. The correct order was verify lead placement and rhythm, measure the client's blood pressure, notify the healthcare provider, and then obtain vials of adenosine. So I guess I was thinking have everything ahead of time and all my information before contacting the healthcare provider, but you'd need to let the healthcare provider know first, and then obtain the vials of adenosine. I'm not sure. I guess letting the healthcare provider know about his status would give us more information on what we would need besides those vials. Maybe he might want to add something extra to it, even though that is the first line of medication for an SVT. He might want to do other things for the client, so it's always smart to notify him first so we have that help and get the information that we need from the doctor. So that is all of my missed rationales. Thank you.